Thanks for tuning in. We're excited to share our insights and experiences with you throughout this podcast. The content shared here are for informational and entertainment purposes only. It's not intended to replace professional medical advice, diagnosis, or treatment. Always consult with your physician or qualified healthcare provider for specific medical advice. Thanks for listening and being a part of our community.
I'm Allison Blakewell, owner of Fort Worth Wellness and a NAET practitioner.
And I'm Ashley Lilburn, a NAET practitioner as well.
So we're just going to tell you all a little bit about our background. I started out as a cardiac nurse and moved on to get a master's in nutrition. I came to NAET through being a patient myself. I had a long health journey, and this was one of the things that was the most helpful to me, and I just had to go learn how to do it. I went and studied under Dr. Devi Namboodirpad in California and then started seeing patients.
I love that. And that's how I came to NAET, because you were my daughter's NAET practitioner. So my background is that my undergrad's in psychology, and I worked for a government contractor prior to having children. Had a child. She was chronically ill. We did Western medicine because that is my parents' background. And then that wasn't working. And so my best friend told me to bring my daughter to you. And we did. And we made some lifestyle changes and then did NAET. And she hasn't needed a doctor in 6 years for illness. And so then I was in the same position where I was like, okay, I need to learn why that worked. So went back to grad school, got my master's in boards in lifestyle medicine, and then got NAET certified and I started working with you and for you in 2020 while I was in school, because my schooling was supposed to be in person and it was all shut down. And so I got a lot of my clinical through you.
Yes. And I remember learning about the degree that you were getting, and it just sounded so intriguing to me. Made me want to go back and do the same thing you were doing. I had school envy. I love school.
Files.
Yes. Always life learners.
Yeah.
And you had sent me a text message saying that you would like to work for me. And I immediately said yes, because you were the right person and I could just feel it right away. It's really what we do is very unique. And so it takes a unique person that has a lot of the background to pull from and somebody who can really put puzzle pieces together. So I think the psych background was really helpful for you. Mm-hmm. And then I also just think that anytime, at least this has been my experience, this is very, very helpful having a family and knowing these tools. So raising children who have a variety of illnesses and you're trying to figure out how to help them, this has just been so fun having this tool for our family.
Yeah, it's been life-changing. I mean, it was life-changing for you and your health challenges, and it's been life-changing for our family and very empowering. So I think that's the other part of it. From my personal experience was I really wanted to feel empowered in my family's health. Whereas I felt like when we were doing traditional routes, it was very, I didn't have any say. And for me, that empowerment of like, well, I don't have control over everything, but the things I do have control over, I would like to. And learning those and what does that mean and what can I be doing to help has been really, really helpful.
I think it's so fun to see parents that we are caring for their children or even just for themselves. It's watching people learn about their bodies and how to have kind of a conversation with your body and understand the nuances of what it's trying to tell you. Because essentially when you have a disease or a symptom, it's your body crying out, trying to tell you something is off and trying to piece together what it is and how to repair that or how to help your body to repair itself. Is just really cool. And as we work with people, I think they start to be able to understand more of what's going on.
I think so too. I think two things that we do well that are helpful long-term for people, among other things, are one, teaching them how to trust their bodies again, like understanding that what they're feeling is real and that they are allowed to give it attention and it probably needs attention.
Yes.
And the more they're able to go in and kind of discover, the better off they are with being able to move forward with it. And I think that that's something that is really helpful. And I think another thing is that anytime you can empower, especially a mom, right? A primary caregiver of any sort with tools, it's going to infect their whole family in a really positive way.
I've also noticed that moms are very intuitive with their own children. So you and I would say, are very intuitive people, meaning that we can understand the body and frequencies and kind of get a gut instinct of what's going on. But even if you're not a very intuitive person, mothers are equipped by nature to be very intuitive with their children. And so a lot of times they'll have gut instincts of what's been going on. And if we can listen to them, we often are able to help solve their problems a lot better. And I've found that a lot of times, maybe the mom does have an idea of what's happening, or she feels very empowered when it's like, oh, it actually was that cereal, or it was, food dye or something like that.
Yeah. And there's no person that knows your child better,
right?
Than an attentive mom. There's nobody else that's going to watch them as closely. And so the more that we can work as partners with them, the better off, the quicker we can help them and the more empowered they feel.
I like what you said about paying attention to a certain problem or noticing it in your body. Western medicine is very designed to suppress symptoms. And sometimes we need that. If you're in a great deal of pain or something like that, even just to stop and focus and think, you may need to suppress pain or even inflammation, because the body is trying to bring healing to an area, but sometimes that inflammation is too much. But at the same time, if you don't stop and try to get to the root cause of whatever's causing that, then eventually the body's going to just sort of compound problem after problem. And so actually stopping to pay attention to what could be causing the symptom is just super helpful.
Yeah. And gets you to the other side quicker.
Yes.
Yeah, I agree. Tell me about muscle testing and NAET.
So muscle testing is also sometimes called MRT, muscle response testing, or applied kinesiology. This is used in a variety of disciplines, but it's very possible that you've probably never seen anybody do muscle testing. So when you first come into the office and you experience muscle testing, it almost feels a little magical. It's a bit mysterious, because what you're seeing is the electricity of the body, and you take a different item, whether it's, an allergen or an infection or even emotion, and you can see how that affects the electrical system of the body. And we use a test muscle. So typically you'll have, an arm that you hold out, and the practitioner will push on your arm. And most things you'll be able to hold completely strong. And there's certain things that it's amazing, but once that is in your field, if it makes you weak, it's kind of like Superman and kryptonite, and the signal will, be disrupted, and you will actually feel a big shift in the strength of your arm muscle, and potentially even just your arm will flop down.
Yeah.
And so we can really see a lot about the body through muscle testing. And it's just one tool that we have to test and see what could be the cause of what's bothering you.
I love that. And then tell me how that relates to NAET.
So in NAET, Nan-Butyropat's allergy elimination technique, we take the thing that you're bothered by and we reset the body so that it now feels neutral to the item. So at first it was blocking you up. And then there's a series of pressure points along the spine, and then acupuncture points on the hands, arms, legs, and feet. And we stimulate those points. We also engage the nervous system. So we'll have you breathe fast and breathe slow to simulate, stress and rest mode. And then we just help to reset the body so that now it sees the item as neutral. So if you were around a tree and you're sneezing and, wheezing and you're blowing your nose, after a NAET treatment, you should be able to be around that item and feel neutral.
I love that. And then why do you use vials? What's the point of the vial?
Okay, so water holds pattern or frequency. So we can have these vials programmed to different things. Now, when I first started as an NAET practitioner, if I didn't have a vial for something, I would take the actual item, which works great. If you're allergic to a banana, okay, you can hold the banana and we can do the treatment. Your office ends up being, just stashed with all kinds of things. And, maybe the sample becomes moldy or, whatever it is. So, there are several places where we can buy vials. We actually have a machine where we can program them ourselves, and we can keep them neatly in little books and have a card catalog system and easily locate the vial. There's also things that are hard to put into a vial, like an emotion or something like that. So we need that programmed elsewhere.
Yeah, I love that. I would say too that another reason for vials is if somebody is extremely allergic to something and you don't want to actually put it in their hand because it would cause reaction.
Yes.
But we can put the frequency of the thing in the hand and then essentially desensitize over many treatments.
Yes.
So that maybe they can hold that thing in their hand.
Yeah, you bring up a really good point because sometimes we treat people who are anaphylactic. And so that means that if they even touch the item, they're going to have a reaction. Right. And so in those, there's actually a protocol in NAET to address anaphylactic. So we can treat sensitivities in, several treatments, but an anaphylactic allergy, which we do, there's a whole protocol, and you don't even, sometimes you could even put the vial in a glass jar so that you're separated a little bit more. Yeah. Sometimes we even need a surrogate. So we may need you to bring your mother or a friend or somebody to where they can hold the vial for you, and then you can touch that person and it can make it a little bit safer.
Love that. And then, so with the protocol, there's something called the Basic 15.
Yes.
Can you tell me about the Basic 15?
So the Basic 15 are the vials that are vitamins, minerals, they're blends of things. So for example, in the vitamin C mix, there's fruits, vegetables, things like that. But also the hormones, there's digestive enzymes and the stomach acid, and also yeast. So these are a series of treatments. The reason that we have them is if you're bothered by the core nutrients or things that help your body to function properly, you can't just avoid all of those items. Those are actually necessary to be integrated and understood by the body so that the body can function properly. So doing the Basic 15, one, it's really comprehensive, and it helps you to get through them faster because they're designed in certain mixes so that you can receive similar treatments at the same time. And then also they're foundational. It's just the foundation to make sure that your immune system's working properly and your digestion and things like that. And so we often find that if you do the Basic 15, you'll retain the other treatments better, you'll get better results, and just sometimes a lot of your health ailments just clear up by doing the basics.
Yeah.
What's your experience been with the Basic 15?
I feel like it does help to expedite past that. So if somebody has, severe digestive problems and we can do the Basic 15, we may actually need to do fewer treatments in totality.
Yes. Yeah. Like grain mix, for example, that's a good one because there are, corn, wheat, all the different grains in one vial. And for example, I did a really in-depth testing on myself called a wheat zoomer, or no, it was the grain zoomer. So it had all of them. And I found out that I had been treated through NAET for gluten quite well, and it didn't show up gluten allergy anymore, which was awesome. But there was another grain that I was really allergic to. And so, doing the entire grain mix is really good because a lot of times we have cross reactivity, or, you have a lesser sensitivity to another thing. We've had times where somebody went gluten-free, but they didn't feel better because they actually were substituting a lot with oat. And when we did the blood work, they were quite allergic to oats. And so, they didn't feel better getting off of gluten because of what they substituted it with.
That makes so much sense. And what would be your preference? Is your preference because we do blood work at Fort Worth Wellness. We do both, basic labs and functional labs, which is amazing. We don't require it, but what is your preference? If somebody's coming in with really strong allergies, is your preference to have IgE testing, which is the biomarker for a proper allergy?
Yes, I really like, so one of the things, you and I have talked about this back and forth a lot through the years because, getting blood work, it's an investment. And if we can spend the time doing the treatments on somebody rather than having you to pay for the blood work, we love that. However, sometimes we find things through the blood work that we weren't expecting, or the blood work also shows severity. So it can really highlight for us what things we really need to focus on. Sometimes there's low hanging fruit. There's certain sensitivities that we could treat in a few treatments and we could kind of wipe those out and you could proceed eating those things. Or, if it's something in the air too. But, then there's also ones that we go, oh my gosh, we didn't realize that one was so strong, right? Because muscle testing, you really just get a strong or a weak test and you don't necessarily get the gauge of how allergic. So we really do like blood work. And I think sometimes the problem is knowing, should you do the sensitivity testing, which is IgG and IgA? Should you do the IgE testing, which is more along the lines of the anaphylactic type allergies? My preference would be that we had all the testing because it's the most full picture.
Yes.
But that's a conversation I usually have with the person individually of like, okay, what is your budget? What is our priority? And just kind of piecing together what is the right order to do those things.
Right. I love that. And I love that we have the capability to help people without the lab work.
Yes.
But I do love having the lab work because I think it gives us something black and white, especially when we're talking about a proper allergy with IgEs, where we can look and see if the classification has lowered after NAET.
Yep.
Which is what NAET's research is based on.
Is the IgE testing. That's right.
And so I really love, especially for somebody who's coming from a Western medicine background, it is often very helpful to have that for people's reference to see that something's actually changed.
It really helps
in the physiology.
I did it with all my kids. Let's see, it was probably about 3 years ago. We had not needed any Western medicine for probably about 8 years. And then we went through a cycle where all the kids were getting strep throat constantly. And root cause, I know people get strep throat sometimes, but it just felt like there was something deeper that was happening. And so I just wanted to do kind of a fresh look with the kids and see what was happening. And when we did the testing, their gluten allergy was actually like, it wasn't even just black and white. It was color coded. It was red. Yes. And the red means bad. So it was actually really helpful to the whole family too. So I could show everybody, this is your picture. This is going to take a lot of NAET treatments. I can fix it, but taking this out of your diet for a while is going to allow your immune system to heal. Yeah. And, you need to ask me if you want to eat gluten again, then you need to take it of your own accord to say, Mom, can you do a NAET treatment on me? And we need to do this kind of on a regular basis. And then we'll introduce those foods back.
Yeah. I think that's such a good point is the period of avoidance sometimes is necessary. So NAET is great because we can get a lot of foods back often if we're, depending on the severity, what classification we are with IgEs. But the period of avoidance, I think, is important. And, none of us like avoiding foods. None of us want to not do the thing, right, that we like. But the period of avoidance is important because, like you said, it helps the immune system to heal and lowers and gives our body a time to lower inflammation so that it can receive treatments and continue healing well.
Yes.
So I do think that sometimes there is, one of the things that we work with muscle testing is as we reintroduce a food, as it becomes safe, is maybe there's a threshold of tolerance.
Sure.
So something we can use muscle testing for is like, okay, are we going to bring dairy back in? Sure. Yes. The answer is yes. Your body's strong to it, but maybe your body doesn't want 3 glasses a day right off the bat. Maybe it will tolerate a quarter cup.
Sure.
And we can use the muscle testing to ask that. Yeah. And that's super helpful so that we can, and maybe there is a threshold of tolerance where the body's like, that's it. Like, that's really all I want. And it's important to know that we come in and out of those places where if our body's really stressed with different things, which I think we need to talk about next, which is like, how are we defining allergy, you and I?
Yeah.
If we're coming in and out of allergies, which we'll define in a minute, could we see a relapse?
Yes. Okay. A lot of people always want to know, is this permanent?
Right.
And the answer is yes and no, right? It's nuanced. Right. I mean, there are times where you can treat somebody and totally take away their allergy, but what you're talking about is the nuance of sometimes your body goes in and out of things. Stress is a huge factor. There's other factors that go into things being re-triggered.
Right.
So emotional stress, trauma, your body goes through surgery. Maybe you have a huge hormonal shift. You have a baby.
toxic exposure.
Oh, toxic exposure is big, and mold has become a huge hot topic because that is, fits a lot of the boxes. It's an allergen, it's a toxin, it's an infection actually in the body. So there are things that happen. Unfortunately, we're not just a car that you can, even cars, right? Like you have to, there's maintenance.
Yeah.
So there is maintenance involved, but the short answer is sometimes you can fix something that you were quite allergic to and you can tolerate it for decades at a time.
Yeah. You fixed Shepherd. So we have a son, and my son, a couple years back got really allergic to chlorine just overnight. And it was really scary because it became a breathing issue. So he would wake up very early in the morning and his lips would be blue. He was like in an emergent situation.
Yeah. So scary.
It's so scary. The worst. And so we figured out it was chlorine. You treated him once. We had a very long period of avoidance. So it was 5 days, which is more tricky than you think because chlorine's also in tap water. So like he couldn't bathe. We had to filter his water, distilled water. Like it was more tricky than you would think it was for 5 days. But he never had a problem again. And that's been several years now, at least 3. So, and he swims a lot. So,
and like, think of how different his life would be if you said, sorry, you can never swim again.
So, I mean,
or just even like you said, the shower, or
oh my gosh,
even if you put in a huge filtration system on your whole house, what happens when you travel?
Right, absolutely.
So, and these are a lot of the things that the general public, either they never figured out what the trigger was.
Yeah.
And they go to a dermatologist and they, say maybe change your detergent but essentially they may not really ever figure out the answer to that because there is no blood test for allergy to chlorine.
Right. And when we actually did go to a doctor, and so that's an interesting, this doesn't need to become Eastern versus Western or, but I will say that I actually looked up some of the literature on chlorine with lung inflammation, and in the UK, it's quite documented properly through journals. In the United States, we don't recognize that as much.
Interesting.
And so when we went to the doctor and I brought it up, it was a hard no. But then when you and I you treated it, it's gone away completely for years.
That's so interesting.
Which is wonderful, right? Like life-changing for him too, so that he could swim and, not have to worry about all that. But so that was a fairly simple, I would say that's a fairly simple case. And then there are really, really complicated cases or really deep allergies where it takes a lot longer and multiple treatments.
Yes.
Okay. So I want to talk about home treatments because that kind of makes me think about home treatments.
Yes.
But tell me how you define, or maybe how Dr. Boudreauxpad defines, or maybe how you define allergy. Tell me about that.
NAET, because it's really focused on the electrical side of the body, it's a different lens to look at everything through. Yes. So I go back to my training as a nurse, and I was really drawn towards either working with stroke patients or cardiac. And so I ended up on a cardiac unit, but I look at the central theme is really that those patients are dealing with electrical disturbances in the body, whether it's a brain disturbance or the heartbeat is irregular or something like that. And but Western medicine's really focused on the chemical side. So even if we see that there's an electrical imbalance, we're trying to figure out, okay, is there a blood clot? Is it do we treat them with drugs that are mostly chemical based? But we use the electrical, EKG or an EEG, and we're watching the heartbeat or the brain waves on the screen and seeing if what we're doing is actually affecting it. But nobody's really focused on how to adjust the electricity specifically. And if you look at other places around the world, that is actually a factor in how they look at the body. So Eastern medicine's very tuned to that. They understand that there are channels and pathways that the body has electricity pulsing through it. So for example, acupuncture, they're using pressure points that are related to kind of wireless pathways in the body. So that was a long way to say that in our definition of allergy, yes, we know that you have a histamine response and things like that, but we're really distilling it down to anything that has a frequency. Everything has its own frequency, but any frequency that you put in the body that causes disruption. And when that happens, it's going to cause electrical disruption somewhere in the body, and it may be multiple places. So maybe you get multiple symptoms. Like, if it disrupts the lung meridian, you may get asthma. Or if it disrupts the brain, you're going to potentially have a migraine or brain fog, or we've even seen stutter that's gone away through treating an allergy. But really our job is to not only unblock the disruption, but to reset the body so that it's no longer bothered by that frequency anymore. Ashley, can you tell us a little bit about how we can treat things that are other than what you would think of as a typical allergy?
Yeah. So I think the way I used to think about allergy is I thought, okay, you walk outside, there's pollen, you sneeze, right? That's how I define allergy. But I think based on Nebuchadnezzar's allergy, the way I think she would define it is anything that bothers the body.
Yeah.
So there can be a lot of different sources. So it can be environmental allergies or food allergies or pathogenic, which would be virus, bacteria, yeast, mold, things like that. It can also be emotions. Yes. And one of the ways that I've been talking about emotions is that I think we're thinking about it backwards. So I think emotions, people think of very woo-woo. Like you think, okay, I'm having an emotion. It's out there. It's outside my body almost, right? But I think it's backwards. So if you think about how an emotion is created, it's actually a chemical reaction in the body.
Yeah.
So anger is one most people can relate to because there's very clear emotional signals, right? Like if you're really angry, your heartbeat will, go fast. You get sweaty. You might get hot. That's a chemical reaction in the body that then the brain is trained to say, okay, that's anger.
Yeah. And even children have to be told how to translate what they're feeling and
into emotion.
What is that?
Right. But we as a society have thought emotions are a head thing, right? In our head.
Yeah. It just lives up here.
But I think it's the opposite. And I think it's much more grounding when we think about emotions as chemical reactions in the body, and any chemical reaction in the body can create blockage.
Yes.
Right? Whether that is an emotion that has released these hormones and chemicals that make you feel hot, or whether it's something that you've breathed in to your body and now you're reacting to it.
Yeah.
But it's really helpful for us to think about emotions in that way because, in even outside of NAET, in the larger medical community, trauma has been much more recognized in the last few years through literature as having a huge effect on the body, right? Like we can look at things like ACEs, which are adverse childhood experiences, and there's 8 of them. And depending on how many of those boxes you check, they can actually correlate that to how likely you are to have autoimmune or diabetes or heart problems or cancer or a lot of these chronic issues that we're seeing a huge spike in, right? And so I think that when we can look at the emotions as a more physical and chemical reaction versus a woo-woo head reaction, it helps us to understand how those can actually be allergies. And so that's how I've been defining allergies lately and feeling a lot more understanding about why that can be so internalized in your body, not just your brain. Like it's not a head problem. It's a body reaction.
And I feel like this is becoming a little bit more popular. Yes. There are more people that are talking about these things, recognizing it. The Body Keeps the Score is a popular book, and just talks about how we store these things sometimes in certain locations in the body and how that causes disease.
Yes.
And I think you can do therapy and talk through what you're feeling, but sometimes people really don't even know what emotion they're storing. Yeah. Because maybe they have pocketed it somewhere. And so it's not even really accessible to their brain. Speaking of it being in the brain, it's like we do need our brain to process some of these things. Yes. But if it's been stored or trapped somewhere, you may just have pain at your knee and have no idea what's causing it. Yeah. And you couldn't even process what it is because you wouldn't know what the trigger was or what's there.
Well, I have a personal example. So I have this thing in my collarbone where it gets trapped, and I just have some physical sensation there almost every day. And I asked you to treat it, and it was an emotion. And even though I do this every day, all day long,
I still get surprised too. It's so funny.
Yes, I totally was like, okay, well, let's treat that and see what happens. And it went away. Like immediately. It was like the thing that was causing blockage. It was something I had worked on physically. I had had body work done, and all those things are beautiful and good and helpful. And I, would not do it, but it was just so funny to me. I was like, oh, yep,
that was it.
Yep, that was it.
So that's why muscle testing or kinesiology is so helpful. Now, to do muscle testing, people ask me, okay, like, what are you tuning into, or how does this work? How does muscle testing work? So my view is that the body has, we're keeping score of frequencies all the time. Like it's almost like a computer in the background. But I always tell people that the 5 senses are all the frequencies that you consciously interpret. So color, sound, even smells.
Yeah.
And there's a lot of frequency though that's just happening in the background that your body's processing, and you'd be sensory overloaded, right? If you were doing that constantly. And so there's a lot that's just happening in the background, and muscle testing can kind of help to tune into some of that. And your body can help us to react to those things. Now, interestingly, with muscle testing, you can almost query like a computer. You can ask a question because words have frequency. And so you can say, is this how did I even know that you had that emotion there? Right. So I'll just take you through a little bit of the processing. So I would ask your body, is this pain caused by, and then we start going through some questions like, is it an emotion? Is it a toxin? Is it an infection? And then through muscle testing, it'll go weak on one of those things. So now we've just narrowed our focus to a lot. Then I go to a list of emotions. Is it this? Is it this? Is it this? And then there are different levels that you can store something in. Is it in the muscle? Is it in the bone? Is it in an electrical pathway? Is it in a meridian? And so we can just sit there and kind of dial into what it is. And it's, we're not tuned into something specific other than just the body's frequencies.
I love that. And I think that it's really helpful for people when, like what you do and explain, like kind of make it palpable, the frequencies. So one of the examples that I've used for people when they're like, I don't, it sounds kind of weird, or I don't get that, is I think most people can really relate to the experience of having one of two things happen when you meet somebody. Either you meet somebody and you're immediately like, ooh, that is not safe, right? Like you've met somebody and you're like, I don't feel good here. Like this, I need to get out of this situation, right? Most of us have had moments.
At some point, yes.
I mean, hopefully not daily.
But it happens with babies all the time, right? That's all they have to go by.
Yes.
And then we kind of train ourselves out of that a little bit,
totally,
right?
Social standards kind of make us like, be a little, we can't cry out loud about it, but we definitely feel that. Or vice versa. If you've ever met somebody that you're like, oh, you feel like home.
Yeah.
Right. Like you feel really safe. I know immediately that I'm okay here. And that is frequency, like, right? That is our field picking up on somebody else's field and being like, we're compatible or we're not. And so I think that, when people hear that, they're like, oh yeah, they've definitely had those experiences.
And sometimes you've even had an experience where you walk in the room and you can like feel the emotion or the tension. Like there's a lot of language in that we have, like how you can, cut the thread, or like there's, feels like ice, or there's tension, or you walk in and like the hair on your neck stands up or something.
Or it feels great.
Or it feels awesome.
You're like, oh gosh, I just want to stay here forever. Yeah. So I think that's a good way for people to understand frequency, that you, like you're saying, is background noise.
Yes.
And it it very rarely comes up front that extremely, but most of us have had the experience of having it come up like that.
You mentioned the field, and I think a lot of us are not really aware that our energy interacts outside of our body. And I think sometimes our spinal cord, we know that things are happening electrically in the brain, and then you have this big spinal cord, and then the nerves come out from that, and there's signaling happening. So if you want to engage your arm muscle and not let me push your arm down, you have to think a thought and send it down the muscle or down the nerve to the muscle, and then engage that muscle. So that's how the body works, right? Is through these signaling, and chemicals are involved in that process. Even if you think about electrolytes, I mean, the electricity in the body is carried through water, and the minerals are very important. So that's why it's really important to stay hydrated. But there's also a field around us. And when you think of thought, instead of it just being this one thing that goes from here to here to here in the body, you can kind of think of it like a broadcast coming out of a radio or something, and it radiates out from you.
Right.
And other people around can pick up on that. We're all transmitters and receivers of frequency and energy.
And this isn't woo-woo. I mean,
this is scientifically.
This is stuff that you can actually see on imaging. And one of the ways that I've explained NAET to kind of back up a little bit of is there are so many things that science hasn't caught up to.
Yes.
Right. So like a personal example in my life is when 20 years ago when I was undergrad, Reiki and meditation, at least in Fort Worth, Texas, were thought of as very weird.
Yes.
Very fringe, right? Like, ooh, like maybe I was vegan and meditated and did Reiki. And I think people were like, ooh, I don't know about you.
Yeah.
You know, at TCU, they're like, you're a real weirdo, which I was. But, you know, fast forward 20 years and we see all the imaging in the brain for meditation. It's super validated, right? That's the word we would use now. This is very evidence-based. This is validated because science has caught up to the imaging of it.
Yeah.
But that doesn't negate the fact that meditation has been used well and had benefit for the last thousands of years.
Yeah.
Right.
I mean,
it's literally biblical. Yes.
Yes.
So, I think that that's one of the things that I like to explain too. While there is a lot of science around NAET, it's also one of those things where I feel like, you know, and I'm so grateful for it that we don't know everything, right?
Yes.
Like science and medicine does not know everything, and we can't capture everything in lab tests or in imaging or.
Yeah.
And so it gives us permission to say, like, it's okay. Everything will catch up to this. I think, you know, I think very famously it's said that the future of medicine will be frequency, right?
Yeah.
And I think we're seeing it more and more. Like when you look at red light therapy, right? Very validated now. Whereas 20 years ago, we've been like, oh no, wavelengths don't matter. Well, they do.
Einstein talked about the future of medicine will be frequency, and Nikola Tesla was studying scalar energy and all these things. So it is kind of freeing to be able to use more than one tool.
Yes.
And sometimes people, you know, they'll say, oh, I'm very sensitive to herbs, or they're so sensitive to medicine and they can barely take any medicine. And, you know, then they receive the innate treatments or the energy work beautifully.
Mm-hmm.
And so it just kind of depends on, and sometimes we need different tools at different times.
Right. And that's okay. And I think that's something I'm really proud of us that we do at Fort Worth Wellness Well is I think that when we feel like you need Western medicine, we communicate that.
Absolutely. Yeah. I mean, I have told people, you know, their skin, they're having a staph infection or something like that. It's time to get an antibiotic.
For sure.
And I think sometimes sometimes people are drawn to us that are, you know, that have maybe had a bad experience in Western medicine, or they've been injured, or there's a reason that they feel some friction there.
Yes.
And so to have somebody like us then to help to direct them and know when it is the right time for that. I mean, I had that experience personally when I really wanted a natural birth on my first birth.
Yeah.
And I read all the books and, you know, was going to do all the natural things. And of course I had a birth plan, and I went 3 weeks overdue, and they just said, you really, really need to get induced. And then the sweet doctor who ended up taking me in the hospital, a midwife, and she had a home birth. So she knew exactly what I was, you know, wanting and hoping for and what my goals were. But when she told me based on the heart decelerations that the baby was having, when she told me it was time for a C-section, I totally trusted her.
Yes.
You know, and it just felt really, I received that information from her.
Yes. Right. Because she felt safe to you.
Yeah.
And you had trusted her through the process, and she led you well.
Yeah.
Yes.
Yeah.
That makes such a big difference when you're able to, I think, and that is something I know from personal experience of you being a caretaker, a provider for me and my family, that you do really well, is that you are really trustworthy, and something that was really, really life-changing for me. And I have emulated now because you did it for me and my family. And now I hope to provide that to people is you gave your phone number, and I was able to text you. And there were several times where I texted you offline and you weren't on, you know, it wasn't during work hours, and you would respond to me, and I felt like you cared. And that was huge for me. Like I'd never experienced that before. And it was really helpful when I was in the middle of not knowing how to help my daughter to have somebody to ask that I trusted. And I knew that if I needed, there was one time I thought she had a seizure and I texted you and you were really helpful. And I knew that if I had needed you, it'd been like, you need to go to the hospital.
Yeah.
Because actually you have told me that before in a different situation. And that is really empowering for me. And so because you did that for me, I do that for my patients now. And I know that that's something that feels good for people because it makes them know that we care.
It does. And I think, the way that Western medicine's set up right now, and we're seeing this, doctors breaking that mold, right? Because there are other providers in Western medicine who also feel this way. But the way that it's set up now is I think there's just so many barriers, right? It's like you have a doctor, but they have a front desk staff and, there's maybe a nurse and then they just get really busy and it kind of goes through all these channels and sometimes you just can't get a hold of anybody. And, I've had that situation with my dad before where like, he has multiple myeloma. And so we had been to MD Anderson and they drew blood for him, but the results weren't there right away. And so I helped get on his portal and I ended up seeing that he was so low in hemoglobin and hematocrit that he needed likely 2 blood transfusions, but nobody had called us or nobody got back to us or even, notified. And if my dad had been the one looking at those results, he wouldn't have even known what that meant.
Yeah.
And so then we started contacting his doctor in Fort Worth to try to, let them know. And we spent pretty much all day trying to get in touch with anybody. I eventually just got him in the car and like went up to the office and they wouldn't really let us in the front door. And so I kind of walked out. You know how sometimes there's like, they reroute you from the front desk to the, out to the exit. And so I kind of went in through the exit and I was like, hey, we really need some help. I'm not sure if we need to go to the hospital or what. And then as soon as the doctor kind of happened to walk by and when I got his attention, he was like, oh my gosh, yes, let's redraw the labs. And they were able to do it really quickly, but it was just, there was such a barrier to getting to anybody. And it wasn't his fault. It's just the way the system was set up.
Yeah.
And so we do try to give people our numbers and we text. And if you see either of our, on the back end, our text feeds, we have probably well over 100 text messages that we're fielding all day long. So
for sure.
If you leave us a message, we will try to get back to you as soon as we can. Sometimes between patients, we're answering questions. But if we ever don't get back to somebody super fast, it's not for lack of trying. And, our front desk staff, they're pretty good about screening things. And if there's something that they see that maybe needs to be answered really quickly, they try to come get us. So
yes. And they help with scheduling and they take.
Yeah. We need a front desk.
Yes.
Like we need people to answer the phones and.
Yes. And I think, we also have families.
Yes.
We're both moms and we're both wives. And so there's also boundaries, that we have to adhere to, and I only say that because, we may not get back to our patient like that minute, but we do care.
Yeah.
And we will get back to them. And so I always tell, because you always do this for me, is like, text me anytime. You're not going to bother me. I can manage myself, right? Like you don't need to worry about like, oh, I texted her at 9 p.m. Like if I am not working in that moment, I just won't work in that moment.
Right.
But there's a good chance I'll see it. And if I need to respond quickly, I will.
Yeah.
And
absolutely.
I think that's really helpful.
And we're happy, like our hearts are happy to do that as long as somebody understands that if we don't answer, we may just be putting a child to bed or, like maybe eating for ourselves. Cause we're kind of, a little bit of workaholics. Like at the office, we don't always, we have to even encourage each other like, oh, stop and eat or,
yes. Or pee
or take a deep breath, And so if we're not getting back to you, it's just because we may be doing something else for that moment. But I think you hit the nail on the head. We actually really do care.
Yes. And I think that is something that is so genuine.
Yeah.
About Fort Worth Wellness. And I will also say that's something really great about our front staff.
Yes.
Is that they genuinely care. Like they know most of our patients. They know, usually they can kind of like foresee what that person is going to want. And like, they're trying really hard to help and they will come get us if there's, things we need to know about. So, I also think that is, because I have been to offices where that's not the case and it doesn't feel good.
Haven't you heard so many stories of people that are like, Dr. So-and-so so great, but like, I hate dealing with their staff. And I feel so bad when I hear that because one, I've been in that situation as a patient, but also like, I feel for that provider because they're relying on that staff to be their support. And really that's like the first person that they see when you walk in.
Yes,
and,
that's who's welcoming you. And I had a comment the other day, which felt so good, which I meant to tell them about, which is I had a little kid in my office, and I was just a real bummer, and I didn't have all the toys in my office, and I couldn't stop because there was multiple people in there. And so I was able to say, hey, like, go see Miss Kaylee, like, go ask her. And I knew that she would be able to give them the drawing stuff that they wanted, you know? And the mom said, I'm really, really, really grateful. It's so family friendly. And I was like, I'm really grateful for that.
We try to not have things be so precious in our office that, I mean, you know, obviously we don't want kids like hanging off of a bookcase or something, but I mean, we do have toys and things to play with. And, you know, both of us are used to children and
so
loud
noise does not bother us.
And we are very good at focusing out. Actually, a lot of times when a mom brings in kids and we do family appointments. So, you know, you can come in and get treated. And then you also have, you know, could have your children treated at the same time. And the only time I feel bad for if the kids are being a little bit loud, I'm like, oh, I'm really good at hyper focusing, but I know the mama is maybe having a hard time hearing what we're saying or focusing, and
or worrying about like us, you know, which I'm always like, I'm not noise sensitive. There's nothing here that bothers me, because truly there's not. But I have been the mom where you're like, stop, you know, and you get like sweaty or whatever.
Or you're like worried that we're going to judge you that your kid is not perfectly well behaved, or like, oh gosh, what if, is she going to think I'm a terrible mom for giving them a screen, you know?
But they haven't met our children. And we're like, well, I won't speak for yours. Mine are feral. So I'm like, we're great. We're good to go. You're doing just fine.
I just always joke because we have 4 girls, but none of them are quiet, you know, none of them are, shy.
Yes.
So, tell me about home treatments.
Okay, great question. So, after somebody has come and been treated at our office, say I'll take my Julia, my daughter, as an example. So she has like a very extreme allergy to dairy. So she's somebody who probably genuinely needs tens or hundreds of treatments on dairy. Because her allergy, just to clarify for everybody, the allergy is so extreme that if she gets dairy, her eardrum explodes within 24 hours. So it's not like a minor allergy.
Yes.
It's a big reaction. So in a case like that, where you have a really big reaction, and that is going to require many, many treatments. So from Dr. Nambujapad's point of view, actually based on classification is how she would say how many treatments you would need.
Yes.
Does that make sense? So if you're, you know, class 2, you need X amount of treatment.
And the classifications that you're talking about are based off of blood work, like IgE allergy testing. And then you would, they can be classified as like 0/1 all the way up to 6.
Yes, exactly. And so based on those, she would say there is an X amount of likely an amount of treatments you would need in order to lower that classification.
Right. Because a lot of times people will ask, like, how many treatments is it going to take?
Right.
And I feel like sometimes that's a hard question to answer.
It is.
And it feels frustrating because I want to tell people it takes 10, you know, it takes this many. Right. And sometimes it's, we can give more of like a range. And then at the end, though, we still have to muscle test to see that every combination, every little part of the body feels strong. And so there may be some of it is
right. So we can't always tell. Right. Exactly. But there can be like a guesstimate. So say, take Julia's example where she's very allergic to dairy and she will need many, many treatments in order to be able to consume dairy well. Then I would say there's something called home treatments, right? Where home treatments are something where the practitioner is going to give a vial of what we're working on to take home. So that you can work on it at home for 2 reasons. One, you know, resources, right? We all have limited resources to some degree. And then also for us, it may not make sense for us to have to treat somebody every day.
Yeah.
If they can do it at home and then they come back after a certain amount of treatments, and then we can do the next combination and start working on that. So it's not that it's not the end of coming to the office, but it's like, if you need 10 treatments on one specific file or combination, then you can do 9 of those at home. And then we can come back and start working on the next to get you through it quicker.
Yes.
So for me, the way I would do that is, once I know it's safe for somebody to do some home treatments, depending on the allergy, then I send home the vial with them and ask them to put it on their body. So, you know, if you're female, you could put it in your bra or your pants or your sock. Set a 20-minute timer, because I find that the biggest mistake people make is that they forget about the vial
and leave it on them.
And then they get real detoxy and upset about it. And then while the vial is on you, do the acupressure points, or what is called gate points, one time, which there's a video too.
Yeah, we'll share that video.
Yeah.
And essentially what it looks like, I mean, you could do it on Julia while she's sitting watching TV and you set a timer, or I've done it a lot of times on my kids at bedtime.
Yes.
It's a great thing. Well, actually your body heals really well during the night. So, you know, you just at bedtime, we're getting ready to read the kids a book. We do a home treatment. I typically in the office, we have those little wraps, those Coban wraps. And so I'll, let them pick a color and we wrap it on them. And then I definitely need the timer so that I remember to come back and collect it off of them.
Yes.
That's a nice routine.
Yes. And I do think that if somebody's going to add home treatments into their life, like they need to do it daily for many days in a row.
Yeah.
The easiest thing to do is to add it into a routine.
Yes.
So for me and my family at home, when we're doing it like that, or for myself, I'll add it to bedtime routine. So it becomes a part of the routine, or else I forget. Anything not in routine, I forget.
And
personally,
the kids like it more when it is a routine. Everything for children seems to go better when it's part of the routine, and they'll actually remind you some of the time. It's not painful, so it's really easy to do.
Yes.
It's not something that you have to do to be able to be in, to come in and get treated for NAET. There's specific situations where we recommend something like that.
Right.
And like you said, we would muscle test to make sure that it's safe. For you to do that. And what would that mean? Like, why would it not be safe?
Okay.
You could have a reaction, right? Like, tell us a little bit about that.
Okay. So, nuts is a really good,
anaphylactic allergy nuts.
Yeah. It's something that everybody is really familiar with. Like, I wouldn't treat somebody with a peanut vial and then send it home with them that day.
Yeah.
Right.
They could actually start having even though the vial doesn't have peanuts in it, it is the frequency of it. So your body feels like it's actually that item. And so when you put that near you, the person can start actually having a reaction to it. Yes. And so we muscle test to see how long when it can be near them and how long it can be near them and all those kind of things. But I would just say, if you're doing a home treatment and you start to see any kind of reaction, like they feel hot or they're having a headache or something, it's not a bad idea just to kind of take the vial away or put it a little bit further away from their body.
Yes. And I think that's a really important thing, is that sometimes there is a what we would call a detox reaction after a NAET treatment. So I'm switching away from home treatments in this moment. I'm talking about an in-office NAET treatment that within the 24 hours, you can see a detox reaction. And what I tell people is it can be uncomfortable, but you are actually asking your body to do some work. So just like in a vaccine, an attenuated vaccine, right, which means that there's a live virus or something in that vaccine and you inject it in somebody's body, the body then is meant to react because you're actually asking the body to create antibodies, right? That's what happens in a vaccine. Well, we are not injecting anything in the body, but we are asking the body to create a reaction. So it's like, it's not actually a negative thing to see it, although it can be uncomfortable. So I have personally detoxed. My family has too. The first time you go through it, it's a little bit uncomfortable, right? Like you can feel fluey or have a headache, or if you are prone to skin things like I am, it'll come out your skin. Like you'll feel a little rash. Like these are all normal reactions, in the same way that when you get a vaccine, you might get a fever, you might vomit. Like there are some things that you're asking the body to work. And so you might see that reaction, and that's not necessarily a bad thing, but we want to make sure that your body is desensitized enough to do that at home on a regular basis. Safely.
We wouldn't throw you into a situation where it would be, a difficult, like too much for the body to handle. Now, patients will ask me, like, am I supposed to feel something? Yes. And sometimes you will doing a treatment. Like I've had people where they have a headache when they're holding the vial, or
their hand sweats.
So like, much. And I mean, sometimes it's a little bit, and like sometimes your hand could be pouring sweat. Yes. I have one particular patient that every time we do a treatment that affects his digestion, he burps a lot. And it's kind of unique to that particular person, but it's like, oh, we're doing, this is a good treatment for you.
Yes.
And sometimes just feeling that particular feeling that you get when you do a NAET treatment, it's a little bit validating for the person. They're like, oh, we're doing a strong treatment.
Yes.
But I also have a lot of people that they don't feel anything.
Absolutely.
And that's totally fine. We actually get really interested or intrigued in like what you are feeling.
Yeah.
And sometimes even I will feel things for the patient because I'm very, tuned in as you are. And I always share with them what I feel. Sometimes it's like, oh, I feel a lot in the neck right here. And it, maybe that's something that's affecting their nervous system or their lymphatic system.
Yeah.
But also sometimes you don't feel anything, which is totally fine too.
Or I'll get, like, personally, when I get treated, like one of the reasons I get resistant to being treated at work is because I get really tired.
Yeah.
Treatments make my body really tired.
So it can feel really relaxing, or it can make you feel an extreme fatigue, because when our body's asked to heal, it goes into like sometimes you have to sleep, right?
Yeah.
And so your body will prioritize, it'll make you get sleepy so that your energy can be focused 100% on healing. It's similar to like when you have an infection and you just need to sleep it off.
Yeah.
And it's another reason why the treatments at night are a really great time, at least in my opinion, is because then it's like, okay, well, it's all right if I'm sleepy because now I'm going to sleep. Yeah. Actually, I had a family that would come to us, and they had some boys that were having some intense health issues, but when they would come, they would always sleep like babies, the mom said.
Yes.
And so she loved when they would come for the NAET treatments because they would all sleep so well. And so that's kind of fun.
Yeah, that is. Yeah, I think but home treatments would be generally less intense than in-person treatments.
Right. And also because we're just doing multiple repetitions of the same item. So it gets a little bit less hard for the body every time you do it.
Yeah, it's kind of like desensitization.
Yeah. Once we introduce a new combination, though, then that might be,
you might go
that's
back
why we do those in the office.
Yeah.
Good question.
Yeah.
Can you tell people a little bit about what a vitamin check is?
Yeah. A vitamin check is what we can do where if you're not wanting a treatment, but maybe you just don't feel very good. And so you're like, I just need to know what vitamins I need to take. And we can check those vitamin levels in your body via muscle testing so that we can put together an individual, like very tailored to you supplement plan. I find this very helpful if you're like in the beginning of a flu or cold or something where you're like, I want to get in front of this and I know I don't feel good. What do I need to take?
I saw somebody on Facebook, just on one of the groups, asking, how much vitamin D should I take? And, there were probably like 73 responses, and, people are saying like maybe 5,000 IUs. And so one of the things about the vitamin checks is that you can tell exactly how much the body needs right then, and it's going to change in time, right? Like if you're
maybe even the next day.
Yeah. And you may only need 5,000 daily. That's a pretty standard dose. But if you start coming down with a flu, you're going to blow through a lot very quickly. Right. And so your need at that moment is very different. And I found that if the minute you start feeling kind of achy or that tiredness that comes over you or a little scratchy throat, if you muscle test and figure out what vitamins that you need and take those right away and don't wait until the very end of the day when you are totally hit with the whole thing, you can usually fight something off and not get fully sick.
Totally agree.
And I used to chastise my husband because he would not want to bother me during the day. And then he wouldn't tell me that he felt sick until the end of the day. And so he's very accustomed now. He'll just kind of show up in my office and be like, you know what, like maybe a little medicine cup would tell me what I need to take. And it's really great.
Yes, that's so helpful. Kind of not pushing uphill, but
so that's an option that we give to people, is just to, and if we can fit you in, we will try to do it really quickly. But if we can help you to not get sick, it's something that we really like. And also too, if let's say you're not coming very regularly, but you, because you've gotten to a nice place of health where you don't need to come every week, you may wonder if what you're taking is still the right thing. Yeah. And that's something that I have never really liked for people, is to take the same regimen for 2 or 3 years at a time. Your body probably needs to be checked and to see what do you need?
What do you actually need?
And I think in the end, the little charge that we do for that is well worth it, because then we can tell you if you actually need the things that you're buying or not. So
I totally agree.